All right, welcome, Emily.
Thank you.
So I'm glad that you decided to meet with me. I know this is our first time doing any sort of career counseling or discussion or anything else like that.
Mm-hmm.
So I just wanted to first kind of get to know you a little bit and how you feel just being in this conversation.
Okay. My name is Emily. I just graduated from Long Beach State with a Bachelor of Science in Healthcare Administration.
Mm-hmm.
I'm currently an administrative coordinator with a mental facility outpatient clinic.
Mm-hmm.
What else do you know? Like professionally or personally?
Yeah, good question, right? So like sometimes when people ask you about yourself, it can be a really broad question.
Yeah.
So I guess what I would like to know, Emily, is like, what would you want me to know? Like, what would be important? What else would be important for you to tell me?
Right off the bat, I'd probably tell you what I'm passionate about.
Sure, go for it.
I'm really passionate about healthcare and delivering it efficiently and effectively and in a low-cost setting is what I would imagine myself in, and not really having to deal with insurance, but that's really hard to not do.
Okay. Okay, so you're really involved in like the healthcare field is kind of what you would like to be involved in.
Yeah.
Okay. Okay. Thank you for telling me that.
Of course.
So as far as that goes, how would you say your current job relates to your passions?
As administrative coordinator, I handle about 5 clinicians' schedules, along with the intake of new patients, along with keeping current ones scheduled and having their claims filed and going through the whole insurance process, or how much it's going to be for them out of pocket if the mental health is not covered. So I would say my job was really exciting when I first started. It's like, cool, like I get to work with families, I get to work with kids, like they need help and we can offer them that help. But there's just that roadblock of insurance. Like, this is what you need to go through in order to get the care. So I stay motivated and driven, even though I can spend up to like 2 hours talking to an insurance representative just to try to get this person authorized for care. It was satisfying in the end when it was approved and we could start the care. It's just the whole process of having the family have to wait and then me have to go through like the tedious call of like, okay, here's this CPT code, here's the ICD-10 code, and it's like the process of having the family to wait was really discouraging for me.
So it's like the family has to wait a really long time, but they don't really know how much you're also waiting to hear back from these insurance
They probably don't know, and
they
they get frustrated when they don't really understand the process.
Okay.
And they have every right to be, because here in the U.S. it's so based on insurance, like whether it's an HMO or PPO, or like how are they going to get care and how much is it going to cost. That's always the question, how much is it going to cost?
Sure.
And sometimes it's not covered, and sometimes families shy away from getting care because it's not covered, and that really makes me sad. But sometimes it is, and that's really satisfying at the end of the day.
Sure, it's like you have these negative parts, which is, you know, the thought of the insurance not accepting the family or the individual, and then you have the other half where you have these wonderful days where everyone gets accepted and everything gets approved and it goes more smoothly, I guess is
so every day in my position it's different. So I can have really good insurance days where I really connect with the representative and I really get like an authorization approved in a really timely manner. That makes me really happy, and it's covered, and they just have like a small copay, and the family's okay, and we can just schedule an appointment. But there are other families who need a lot of help. For example, if they need OT and they need PT and they need psych services, then it's going to take so much longer to just get all that authorized, because the insurance company is wondering if this child really needs all this help. And you have to just prove that this child needs help. And it's also frustrating for the family, and I'm really thankful to families who do stay really patient with me, because they understand how much I'm doing for them.
Sure.
They don't have to do it, so we do it for them, and it like really encourages me to keep going when they are like, well, we have all these things for you, and like, thank you, I know it takes a really long time. So it's gratifying at the end of the day but it is overwhelming. like, because the new patients keep coming in while keep trying to like keep the current ones happy is pretty tough.
Yeah, it sounds like you wear a lot of different hats.
Oh yeah, definitely, definitely. Yeah, it's a bit hazy with my position because as admin coordinator, if you look at my position duties, my official offer letter, it's just like answering the phones and doing scheduling patients and like minor insurance stuff. But now I probably have like up to 15 or 20 like CPT codes just memorized in my head.
Wow.
I did not even know before.
Wow.
And I learned like so many things that you don't learn in school. Like they really do not teach you about insurance in healthcare. Like they really should teach that class because like everything here is like active learning. And I'm really thankful to my bosses for being mentors and always like teaching me, being glad to teach me. So I'm really happy about that. But it was like not in my position description for the amount of work that I would be doing. And plus, I'm the only one in this position at this facility, so it is overwhelming. I would say we were understaffed too for the amount of work that I need to do because I like work a 9-hour day, and then if I have to spend 2 hours just on one case, that backs up all of the patients trying to get care.
Okay.
You know? And it's a little frustrating.
Yeah, I can imagine that can be frustrating. Yeah. I mean, if you're looking at the job description that you have and you're focused on, these 5 or 6 core things, but then knowing later that there is some kind of self-taught essential element to the job. But it does sound like you've acclimated quite well.
Yeah.
I mean, just listening to everything that you do on the daily basis.
Yeah, because I love to learn, but I've also learned within this field what I like to do and what I don't like to do within like this short 8 months that I've been here. I've learned that I don't really like to deal with insurance, but I really enjoy like coordinating care and like knowing what a family needs. When they call and they just list all of these things, and I'm just like, I already know what this person needs, like just from like a 5-minute phone call, and like coordinating their care to the right clinician is really like something really fun that I picked up on while working here. But also just doing little things that weren't in my position that's kind of putting me back. Like I have not one boss, but because I have to answer to all of the clinicians and their schedules, they ask me to do like little things for them, which at first wasn't a problem. But when you keep asking to do little things all the time, then it becomes one of my duties that wasn't on my list. Right. So
instead of having one person you answer to, it can be frustrating to have to answer to multiple people.
Oh yeah, it's like 5 people that I have to answer to. So it's a really demanding position, I would say.
Yeah, it sounds really demanding.
Yeah, it is really demanding.
What is it like talking about it to this extent? Like, I'm wondering if you ever talk about it to this extent with anybody.
I haven't, because when my friends ask me what I do or my family asks me what I do, I get really excited. I'm just like, I get to do all these things. I get to like coordinate care for families who need it, and like we host and manage like health education workshops for families who need it, like in the community, and we see what the community needs and we create like a breastfeeding workshop or something. That's how I talk about it when I describe to other people. But I've never really thought I process it in my own mind, but I've never like voiced it out loud. But yeah, I feel like sometimes they do take advantage because I am very hardworking and I'm very fresh